Good morning. My name is Amal Nirgodkar. I'm the CEO of Patient Prism. I'm here with Dr. John Vaselaney from Brown and Brown, and we're discussing what Brown and Brown is doing in risk management with respect to DSOs. So tell us a little bit about your patient protector plan and how do you help DSOs manage risk?
Sure. Well, the Professional Protector Plan goes back actually 50 years. We're celebrating our 50th year insuring dentists.
Wow. Okay.
Yeah, so it started in 1969.
Okay.
And currently we have 50 DSOs that are insured with us through the Professional Protector Plan for whether it's professional liability insurance, general liability insurance, the whole suite of products that any DSO would need.
Sure.
In terms of risk management, there are a number of resources that are available. There is human resources in terms of individuals to speak with if there are questions that need to be answered.
Sure.
We have risk management courses that are available for CE credit for participating doctors, hygienists, anybody that would need CE credit as well. And those programs can be customized to the needs of any given client, although there are programs that we have in place for dentists that are out there in solo practice. We can customize anything that a client needs to be able to meet whatever their interests are.
So can a small group afford you guys?
Certainly. Yeah, there's tailored pricing for whatever it is that somebody might need. And of course, with DSOs, there's a component of the pricing that's included in that premium. So it's not as if there's an extra charge for some of those services.
So let's say there's a small group, 5 locations, right? They want to come to Brown and Brown. What are the services that you recommend for those guys, like the small groups?
Well, of course, it starts with wanting to make sure that in terms of coverages that they've got the right policy that's tailored to their needs. So when someone starts growing, sometimes what happens is they create additional entities in order to allow for other management interests, other shareholders, partners, whatever you want to call them, and you want to make sure that they have the coverage that's necessary to protect themselves within the context of each entity.
Liability protection.
Right. And sometimes you have people driving. Let's say you have 5 locations, driving from location to location. Are you thinking about the risk exposures associated with an employee driving from place to place? And that's not something that's common in most dental practices.
Right.
So from a risk management standpoint, there are things that we can do live for them. There are things that we can provide in terms of links to resources, again, phone consultations and so forth. There are a lot of times when our risk control hotline gets busy with calls from clients because people just have a question and they don't need an extensive program to answer that question. They just need someone to talk to for a few minutes.
And there's some HR support, you said, in this process too? Like if they have HR questions with respect to...
there's employment practices liability that we offer as well. And so there are vehicles to be able to engage that EPL risk management.
Wonderful. As well. And there is insurance for that as well?
Yes, there's indemnification for that. So if someone has been accused, let's say, of improper hiring practices or firing practices.
Sexual harassment.
Sexual harassment is one of the things that has grown significantly over the years. So there's coverage that would cover an entity or a dental practice for that as well.
In all my years as a CPA, one of the things I told my clients was that you don't know there is a problem until you get it. And by the time you're in the problem, it's too late to really go back and fix it. So having at least a risk assessment done, and you will do that for clients.
Yes, we will.
To kind of understand the scope of your risk. Because if you don't even know the scope, right, you have no clue. You're completely blind. And here you are like, oh my God, was there insurance for that? Oh my God, I didn't even know there was an insurance for. So that, I think, is something that we tell our emerging guys as well, is that engaging the right people that'll at least give you don't have to buy everything that's out there, but at least understanding your risk.
Right.
And mapping it out and knowing at what point you should get what is crucial. Is that correct?
Yes. So one of the things that I think a lot of purchasers of insurance coverages don't really think through is that although the top line coverage for fully insuring one's needs might be something that they feel is an expense that they're not ready to undertake, at least having some minimum level of coverage for that is really important, because you don't want to be bare on a risk exposure. You want to have some level of coverage, even if it's not the ideal to which you aspire to have at some point down the road.
And you can always add, right?
You can always add
it's like
limits.
Term insurance where you convert.
Right.
Absolutely.
Right. So, for example, with some of the DSOs, it's possible if a DSO, let's say, has some operation facilities where
Yes.
there's general dentistry being done and others where there's specialty care being provided, oral surgeons, maybe you've got some sedation going on. There are ways to be able to customize the limits for each segment of the clinical care,
Absolutely.
so that way you're not overpaying for the coverage on the general dentist or underpaying on the coverage for the specialists.
Absolutely. How are you? So how do you contact? How do people contact Brown and Brown? What's the best way to get in touch with your folks?
Well, our website is protectorplan.com.
Okay.
And there's a map there that has all of the various state administrators that we distribute the product through. And you can find the local agent in your state on protectorplan.com.
Thank you so much. It was a pleasure talking to you.
Pleasure talking with you as well. Thank you, Amal.
Absolutely.